Hello, everyone, and welcome to our question lab. We're happy to have you here. Today, we will be covering gastrointestinal pathology. Joining me today is Dr. Paras Vicaria, along with some wonderful panelists. So we'll introduce ourselves to you now. My name is Sean. I've been with RX for a little over a year and a half, working on the RX Coach program, which we'll tell you about here in a little bit. Once again, leading today's dissection is Dr. Paras Vicaria. Paras.
Thank you, Sean. Hey, everyone. My name is Paras. I am currently a resident physician in dermatology at UT Southwestern here in Dallas, Texas. I originally first completed pharmacy school in St. Louis, Missouri, and then went back home to Michigan to do medical school. I've been with RX, specifically as an RX coach for a little under a year now, working one-on-one with students primarily regarding USMLE Step 1.
Excellent, and we're happy to have Dr. Vicaria with us as always. We also have some wonderful panelists with us. Our first panelist today is also an RX coach. His name is Kasia Bornstein. Kasia.
Good evening, everybody. My name is Kasia Bornstein. I'm currently a fourth-year medical student at the University of Miami. Prior to this, I got my master's in pharmacology at Tulane, and also was a paramedic and worked in EMS for 10 years. I also work as part of the RX Coach program or the project, and primarily working with students on USMLE Step 1 material. And it's been my pleasure to be a part of the team for just several months now, actually. So, and excited to get to work with some of you if I get to. All right, thanks, Sean.
Thanks, Kasia. We also have two other panelists, Jeff and Kate, who you'll hear from later. They're here to help answer your questions. So if you look at the GoToWebinar control panel, you will see a question box, and you're able to type in your questions there, and our panelists will do their best job and try to answer all of your questions. We talked about RX Coach, and we're going to talk about that later. You've met us, so we would like to meet you. So I'm going to ask you guys a question. And that question is, what exam are you currently preparing for? So we'll give you guys a second to submit your responses. We always like to know who's in attendance today. So take a second to give us your responses. This is the same exact format that you will see for the questions we'll be doing this evening. We'll be doing 4 questions on GI Path, and you'll be able to submit your answers here on a poll just like you are now. So give you guys a couple more seconds to answer, and then we'll move on. Excellent. So let's take a look here. Looks like 93% of you guys are studying for the Step 1 exam, 3% of you guys for Step 2, and 7% of you guys are studying for the practice exam, the CBSSA, and several of you guys are here studying for school exams. And I trust that all of you guys will benefit from the session today, and we're happy that you guys are here. Since a lot of you guys are studying for Step 1, I would like to ask you guys, when are you planning on taking Step 1? So I'll give you guys a second to submit your responses. Once again, we do these question labs every Tuesday at 6 p.m. Eastern. Today will be GI Path. Next week, we will be doing cardiac physiology. So next week, Tuesday, 6 p.m., cardiac physiology. And please keep in mind that we do have our webinar with Dr. Towley and Dr. Vicaria on the 20th, and we will be covering pharmacology. So we'll talk more about that later as well. Give you guys a couple more seconds to respond. Wonderful. Let's see. So it looks like a lot of you guys are taking it this fall. We've got some people taking it this winter, some of you guys taking it this summer, a lot of you guys taking it next year, and some of you guys aren't quite yet sure, which is fine. Well, we're happy to have all of you guys here. And with that, we're going to go ahead and get into today's session. We've mentioned RX Coach a few times. RX Coach is our new one-on-one tutoring initiative. We've had some really great success stories recently. One student in particular came in with an assessment of a 167, and then her last assessment was a 237. That is a huge jump, and she still has a few sessions left with us, so we hope to get her even higher score. We'll share a testimonial with you later and tell you more about the program and highlight some of our wonderful coaches and success stories like Dr. Vicaria and Kasia Bornstein. So with that being said, let's go ahead and get into our first question. We talked about, Coach, the methodology that we're using today is what we use in our RX Coach program. The first thing we like to do is cover up the answer choices. And as you guys can see, I have already gone ahead and done that for you here for the first question. The reason we do that is because we do not want the questions to, the answer choices to guide your thought process, to dictate your thinking. And we certainly don't want you to see an answer choice that you're unfamiliar with, and that may cause you to panic as you're reading the question. So we cover that up. And once that is covered up, we read the lead-in or the last sentence together. So let's do that now. What is the most likely composition of the nodular opacities on the X-ray? And once we read the lead-in, we like to ask our students to tell us, is this a one-step question, a two-step question, or a three-step question? And we do that so that we can keep our thoughts organized and answer the right question and get to the right answer. So an example of a one-step question could be where they ask you for a diagnosis. An example of a two-step question could be where they ask you for a treatment for a diagnosis. And an example of a three-step question is when they ask you what is the mechanism of action for a treatment for a diagnosis. So with those examples in mind, I want you guys to submit in the question box and let us know how many steps you think this question will require. And that lead in one more time is, what is the most likely composition of the nodular opacities on the X-ray? Looks like we have some responses. And so after we read the lead in, we like to go ahead and read the question stem. We read it one sentence at a time. And in our coaching sessions, our coaches will stop you after every sentence and ask you what's important, what do you want to highlight? Why are you highlighting that? What are you thinking? Since we don't have time to do that with all of you individually today, I will pause briefly after every sentence to give you guys a second to gather your thoughts. All right, here we go. A 73-year-old woman complains of indigestion associated with fatty foods. She is pale and also mentions that she has experienced chronic fatigue for several years. A chart review reveals a history of aortic valve replacement 8 years ago. An X-ray film of the abdomen shows a cluster of nodular radiodensities in the right upper quadrant. Laboratory studies reveal the following: hematocrit, 29%, total bilirubin, 3.3, indirect bilirubin, 3.0, and a corrected reticulocyte count of 6%. Give you guys a couple of seconds to take a look at that image. And now we will read the lead-in again. What is the most likely composition of the nodular opacities on the X-ray? Dr. Viccaria.
Thank you, Sean. So I think the first step, like you mentioned, is trying to determine how many steps we think this question could be. I think one, we need to figure out exactly what is going on in this patient. Two, how is that leading to the nodular opacities? And then three, what is the composition of those nodular opacities? So this could be a three-step question here. Definitely a lot of things going on. And now I'm going to go ahead and read those answer choices out loud to you guys. And I'm going to work my way from the bottom up. So I'm going to start with answer choice E and work my way up. And the reason we do that, and we recommend students do that as well, is so this ensures that you get through all of the answer choices, and that you won't just see one that you like and select it and bias yourselves. This will ensure that you get through and read and think about each of those answer choices. So let's start at the bottom. Answer choice E, uric acid. D, unconjugated bilirubin. C, conjugated bilirubin. B, cholesterol. And A, calcium oxalate. So we'll give everyone a couple seconds to gather your thoughts. Sean's going to go ahead and open up that poll. Please go ahead and select the answer choice that you think is correct, and we'll talk about it in just a few seconds.
Excellent. Thank you, Dr. Viccaria. So once again, you have the answer choices in front of you. Remember, on test day, you should never leave a question blank. There's no penalty for guessing, especially not today. So make sure you take your best shot, and we'll go over the correct and incorrect answers here in a moment. So take a second, think about the question, and give it your best shot. For those of you joining us, keep in mind that we do have a raffle and a very special offer for you guys at the end, and you must be present to win, so make sure you stick around. All right, let's see how you guys did. Looks like it was a tie between B and D, with 31% of you guys choosing cholesterol and 31% of you guys choosing unconjugated bilirubin. And in second place was calcium oxalate, with 23% of you guys picking that. Let's see what the correct answer is. And the correct answer is D, unconjugated bilirubin. And we had 31% of you guys get that right. And with that, I'll hand it over to Dr. Vicario.
Thank you, Sean. So first, what we have up for you is a diagram and a table from first aid. And as you can see there, this is about cholelithiasis, but specifically stones. So there are two main types of stones, as you can see there. One is cholesterol, and the other is pigment stones. So cholesterol stones, as you can see there, majority of the time are radiolucent, and they make up the majority of stones that you will see. They're associated with a few things as you can see there. Now, pigment stones, as you can see, are radio-opaque, and keep that in mind because they provided us an X-ray image. There's a few things it's associated with, particularly chronic hemolysis and cirrhosis and Crohn's disease, okay? So let's keep those in mind. And if we look at that diagram of the liver, if you look at chronic hemolysis and biliary tract infection, it shows that it is increased unconjugated bilirubin that leads to the pigment stone. So once again, it is unconjugated bilirubin, or an increase in that leads to pigment stones. So now we need to figure out what kind of stones these are. Are they cholesterol? Are they pigment? We have a couple clues. So now we'll go back to that question. So they tell us that this is a female patient who has indigestion with fatty foods, and then they also show us these radiodensities on that X-ray. So this patient is likely experiencing biliary colic, when those gallstones cause pain during contraction of the gallbladder, particularly in the presence of fatty foods. They also tell us that this patient is pale and has chronic fatigue, and they also tell us that she has a low hematocrit. So likely getting at that she has anemia. They also gave us a few other helpful clues. They told us she had an aortic valve replacement, an elevated indirect bilirubin, and reticulocyte count as well. What kind of process do you think may be going on in a patient with aortic valve replacement, high indirect bilirubin, and elevated reticulocyte count? Go ahead and open up that question box again, post in there what kind of process you think may be going on, and we'll talk about it in just a second.
Excellent. So a lot of people saying hemolysis and schistocytes.
Great, yes, absolutely. So hemolysis or hemolytic anemia. Now that can occur because of mechanical sharing of those red blood cells caused by that aortic valve replacement. And then the reticulocyte count increases to compensate for that damage. So then what ends up happening is those damaged red blood cells have certain products that then migrate through the blood, where macrophages eat it basically and convert it into unconjugated bilirubin, which is why this patient has an elevated level of that. Now, in chronic or severe hemolysis, the amount of bilirubin may overwhelm the liver, and the liver being able to process that. So this would result in excess unconjugated bilirubin, and then as seen there in the diagram, that can then be secreted into bile, and that can lead to pigment stones. So going back to how many steps we think this question is, 1, picking up that this patient has anemia, specifically hemolytic anemia due to that aortic valve replacement. 2 that's leading to elevated indirect bilirubin that is then leading to pigment stones, which are made of unconjugated bilirubin. And keep in mind as well that these are radiopaque, and the differences between that and cholesterol stones. So let's talk again about the other answer choices and why those are incorrect. So uric acid, normally more common, you would see that in kidney stones rather than gallbladder stones. So thus it's likely not a correct answer in this question. Conjugated bilirubin, so bilirubin can be conjugated and excreted into the feces and urine, but it is water soluble and would therefore not form these nodular opacities. So also an incorrect answer. Answer choice B, or cholesterol, which is also highly selective. This is a common component of gallstones, as we talked about. But this patient, due to the reticulocytosis, due to the anemia, the bilirubin levels, it suggests an alternate process that is forming those nodular opacities. Furthermore, pure cholesterol stones are radiolucent on X-ray, unlike the ones that we're seeing here in this image. So keep that in mind as well. Calcium oxalate also can be a component more so of kidney stones, and that would be more seen in a different area on an X-ray, not in the right upper quadrant that we're seeing here in this image. So the takeaway point from this is clearly you can see how there's a lot of different clues and how this is a multi-step process. So it's important to think through each sentence, try to tie everything in together, and just use that knowledge you have to come up with the correct answer.
Excellent. Thank you, Dr. Beccaria. And let's now move on to our second question of the evening. So for those of you just joining us, we're using the methodology that we use in our RX Coach program, which is our new individual tutoring program. And the first thing we do is cover up the answer choices. And the reason we do that is so that you guys aren't distracted by them. You don't let those answer choices guide your thought process or dictate your thinking, but also so that you don't see an answer choice you're unfamiliar with and end up panicking as you're reading the question. So after we've covered those up, we will read the lead-in sentence, and I'll do that now. Assuming this patient is in the window period of infection, which of the following serologic markers is most likely to be positive? And now that we've read the lead in, I'll ask you guys how many steps you think this question will require, and I'll have you submit that response into the question box. I'll give you guys a couple of seconds to do that. So is this a one-step question? Is this a two-step question? Or is this a three-step question? We have some people saying one step, some saying two steps, some saying three steps, and Dr. Beccaria will go over that with you guys here in a little bit. So once we read the lead-in, we're going to go ahead and read that stem together. Now, of course, if you were a part of our RX Coach program, your coach would stop you after every sentence, ask you what you want to highlight, ask you what the main clues are, and ask you what you're thinking. Since we don't have time to do that today, I'll pause briefly after each sentence to give you guys a second to gather your thoughts. So here we go. A 26-year-old woman comes to the clinic for follow-up evaluation 4 months after being diagnosed with acute hepatitis infection. Physical examination reveals no abnormalities. Lab studies are ordered. Assuming this patient is in the window period of infection, which of the following serologic markers is most likely to be positive? Dr. Beccaria.
Thank you, Sean. So looking at this question, this could actually be maybe a one-step question. So they told us that she has acute hepatitis B, and they're asking specifically about the window period. So based on that, we need to know what markers are positive in that window period. So one, what are they're telling us that this is the window period, and then the first step is what is the markers that are positive in that window period. So this is probably a one-step question. And looking at those answer choices, we'll start at the bottom and work our way up. Answer choice E, hepatitis B surface antigen. D, hepatitis B surface antibody. C, hepatitis B E antigen. B, hepatitis B core antigen. And A, hepatitis B core antibody. So we'll give everyone a couple seconds again to gather your thoughts. Please go ahead and select the answer choice that you think is correct, and we'll talk about it in just a second.
Thank you so much. And just like the last question, we talked about unconjugated and conjugated bilirubin. With these markers, these are both high yield topics, and you're likely to come across them. So we're happy to cover that with you today, and hopefully everybody will learn something. We'll give you guys a couple more seconds to respond. It looks like a pretty even split with these responses so far. If you aren't sure what it is, take your best guess, and Dr. Beccaria is going to go over the correct and incorrect answers with you here in a moment. So I'll give you guys a couple more seconds to submit your responses. And make sure you stick around until the end, because we do have a raffle. You must be present to win, and a very special offer for those of you guys in attendance today. Looks like 28% of you guys picked hepatitis B surface antigen, and in second place was answer choice A, hepatitis B core antibody. So let's see what the correct answer is. The correct answer is A, hepatitis B core antibody. And 25% of you guys got it right. So if you got it wrong, don't worry, we're here to learn. We want you to get it right on test day. And Dr. Beccaria is going to show you how to do that. Dr. Beccaria.
Thank you, Sean. So we do have a nice figure, nice table pulled up here that we'll kind of reference. So this is often a confusing topic for students, and you know, it also doesn't help that you have so many different similar acronyms and abbreviations, HBS, HBC, HBE, and then you have AG for antigen, AB for antibody. So it gets pretty confusing, but let's try to break it down a little bit. So when you first have your acute infection and then it's converting to a chronic infection, you can have what's called a window period. And this specifically refers to the disappearance of surface antigen while surface antibodies are being produced. So it's the period where you don't have any surface antigen present, and you also don't have surface antibodies present yet either. And the reason that happens is because as the body is starting to produce surface antibodies, the levels of those antibodies are still less than the levels of the surface antigens. So all of the antibodies are working their way and trying to bind to all the different surface antigens. So when these antibodies are produced eventually in excess of the antigen, they will then be detected. But in that window period, you have just the right amount of antibodies binding to just the right amount of antigen where neither of them get detected. And that's called the window period. And at that point, one of the few things that is available to be detected is your core antibody. And this is considered still IgM because it's still considered part of the acute infection process. You do also have, as you can see there, anti-HBE, but that was not one of the that was not one of the listed answer choices. So looking at the other answer choices that were there, answer choice E and D, as we just mentioned, both of those are absent in the window period, surface antigen and surface antibody. Those are both absent in the window period, because again, that's when you have basically just equal proportions of those kind of neutralizing each other. Hepatitis B antigen, you do not have in the window period just yet. And then, sorry, hepatitis B core antigen, or answer choice B, that is not detectable because it is surrounded by viral proteins and the viral envelope. At that point, you do have IgM core antibody. So I think the main differentiator is one is this core versus surface, and hopefully we explained to you a little bit about that window period, talking specifically about the surface antigen versus surface antibody.
Excellent, thank you, Dr. Beccaria. And that is a complicated topic, so we encourage all of you to take a look at hepatitis and make sure you're familiar with all of these markers and when they're present. Okay, so with that, we will continue and move on to a little discussion about RX codes. So RX Coach, like I mentioned, is our new tutoring initiative. It's individualized approach. So what that means is, as you guys know, when you're in school, every classmate is different. All of your classmates and colleagues are different. You have different strengths and different weaknesses. What works for one person may not work for the other person. So just like athletes have coaches to make them reach their peak potential, we work with you and coach you for the exam to help you reach your maximum potential. And we help you. The first thing we do is administer a 160 question assessment. And based on that assessment, we come up with a personalized study plan. This way we're doing what's best for you based on your strengths and weaknesses. And that one-on-one approach allows us to bridge knowledge gaps and work on test taking skills so that we can really help you conquer this exam and get the best score possible. All of our tutors are RX certified. They're very highly trained. And now with every package, you get access to RX 360 Plus, which includes our question bank, our flashbacks, our express videos, and our RX bricks. Here's a very recent testimonial we got a couple of days ago, and I'll read it to you. I am very impressed with the Scholar RX program. I reached out after I was feeling very discouraged after scoring low on practice exams. I was matched with my RX coach who immediately helped me identify strengths and weaknesses. These sessions are not lectures. They are one-on-one interactive sessions. My coach and I worked through practice questions together. He asked me questions and made me think out loud in order to understand my thought process. When I was completely stuck, he would teach me the concept. However, he made me work for the answers by really getting me to think through the problem. This was a perfect strategy for my learning style. It was helpful to identify why I was missing certain questions. He also taught me test-taking strategies and encouraged me throughout the entire process. I raised my score over 35 points from my diagnostic practice test to my Step 1 score. I would like to thank my coach for encouraging me, helping to identify my weaknesses, teaching test-taking strategies, and giving me the confidence needed to do well on Step 1. I would highly recommend this program to anyone needing a tutor. So if you're interested in learning more about our tutoring program, please visit rx-coach.com to schedule a consultation to discuss our program and how it can benefit you. If you want some generalized study advice or a free study planner, please visit firstaidteam.com. And with that, we will get into our third question. Once again, as you can see, I've covered up the answer choices and we will read the lead-in together. Which of the following risk factors would most contribute to this patient's condition? So once again, I'll give you guys a couple of seconds to input your response into the question box and let us know how many steps you think this question will require. Which of the following risk factors would most contribute to this patient's condition? And now we will read the stem together. A 76-year-old man comes to his physician reporting black stools and mid-abdominal pain that is relieved by meals. He takes no medications. A stool guaiac test is positive. Upper endoscopy shows a mucosal lesion in the first segment of his duodenum. A stool test for H. pylori is positive. Which of the following risk factors would most contribute to this patient's condition? Dr. Vicario.
Thank you, Sean. So thinking about how many steps this question could be, I think one, we need to figure out what this condition is that this patient has. So that's probably the first step. And then maybe the second step would be looking at those answer choices to see which of those could also be a risk factor for that condition. So I think likely a two-step question here. So let's go ahead and take a look at those answer choices. Answer choice E, tobacco use. D, low fiber diet. C, excessive nitrate intake. B, chronic gastroesophageal reflux disease or GERD. And A, burn injury. So we'll go ahead and give everyone a couple seconds to gather your thoughts. Go ahead and please select the answer choice you think is correct, and we'll talk about it in just a second.
Excellent. So we'll give you guys a couple more seconds to respond. So keep in mind, we're doing 4 questions today. This is our third question, so we have 1 left, and then we'll be doing a raffle and have a very special offer for all of you guys in attendance. So if you're here, make sure you stick around because you must be present to win. And every week we tend to have people who win and aren't here. So you might get lucky today. All right, looks like a lot of you guys have responded. We'll give you guys a couple more seconds. Excellent. And let's see what you guys picked. Looks like in first place was GERD with 32% of you guys picking answer choice B. And in second place was tobacco use with 31% of you guys picking answer choice E. Let's see what the correct answer is. And the correct answer is E, tobacco use. And with that, I will hand it off to Dr. Beccaria.
Thank you, Sean. So yes, great job, guys. This is also a tough question. So they told us that this is a 76-year-old man who's basically having dark stools. So we know that he has some sort of upper GI bleed. The upper endoscopy showed a mucosal lesion, the first segment of the duodenum. So that's important. This is a duodenal lesion. Now, when we look at that table about H. pylori, kind of the fourth sentence there talks about how this can cause gastritis and specifically peptic ulcers, especially duodenal ulcers. Okay. Now, they did tell us that the stool test in this patient for H. pylori is positive. So because he has a mucosal lesion in the duodenum in the first segment, this indicates that he has a duodenal ulcer, which is a form of peptic ulcer disease. Peptic ulcers are most often caused by H. pylori, as is in this patient, and the incidence of H. pylori-induced ulcers is increased in patients who smoke, which is why tobacco use is a correct answer. Now, can you guys name some other risk factors that exist for the development of peptic ulcer disease? Go ahead and post in that question box some risk factors that you know of that could put you at risk for peptic ulcer disease.
Looks like we have some people saying NSAIDs, alcohol, steroids.
Yes, absolutely. Great job, guys, especially NSAIDs. 100%. Great job. Now let's talk about why the other answer choices are incorrect. Low fiber diet. Now, this is probably getting at that it is a risk factor or can predispose you to developing diverticulosis, which is when you get outpouchings, usually in the sigmoid colon. Now, these can bleed, and they can also become infected. But bleeding from this area would, again, remember, probably be more bright red and not dark. And in addition, we already know that there's a mucosal lesion in the duodenum, so likely not diverticulosis. Excessive nitrate intake. So the consumption of nitrate preservatives has been identified as a risk factor for adenocarcinoma or cancer of the stomach. They don't play a role in the development of ulcers and PUD and wouldn't exacerbate, per se, existing ulcers. So that's getting more at stomach adenocarcinoma. So also an incorrect answer. Now let's talk about B, which was also a highly selected answer, chronic GERD. Now this can cause, importantly, esophageal mucosal lesions. And this is because of long-term exposure of that esophagus to the low pH contents of the stomach. So this would be more esophageal mucosal lesions. GERD doesn't really play a role in the development of duodenal or gastric ulcers, so likely an incorrect answer as well. And then lastly, answer choice A, burn injury. Patients who have sustained significant burn injuries are at an increased risk for upper GI bleeding, either from gastritis or discrete ulcers, which are called curling ulcers. Now, there's nothing in this patient's history that would give us any, suggestion that he had a burn injury. So in this answer choice, in this question, the correct answer choice is likely to be tobacco use.
Excellent. Thank you, Dr. Beccaria. So Once again, another challenging question, rather direct vignette, but some important clues to pick up on to help you get to the correct answer. So if you guys got it wrong, please review this in the materials that we have. RX 360 Plus is a great resource. You can look at bricks, you can look at videos, flashbacks in our question bank to get some more practice. All right, let's move on now to our last question of the evening. Once again, if you guys are liking what we're doing today, we do these question labs every week, Tuesday at 6 p.m. Next week, we will be covering cardiac physiology. On the 20th, we have a webinar with Dr. Lee and Dr. Vicaria. Of course, Dr. Lee is the senior editor of First Aid and the founder of USMLE-Rx, and he will be covering pharmacology along with Dr. Vicaria on the 20th. So make sure you tune in to that webinar. Once again, if you're interested in RX Coach, that website is rx-coach.com. You can schedule a free consultation to talk about the program and how it can benefit you. We've had some great success stories recently. I shared our testimonial with you and told you about a student who went up almost 70 points with us. So be sure to check that out if you want to really get that edge on test day. And here is our last question. Once again, you guys will see that the answer choices are covered up, and we will read the lead-in together. Which of the following is the most likely cause of this patient's condition? So once again, I'll give you guys a couple of seconds to let us know how many steps you think this question will require and submit that response into the question box. Excellent. Looks like we have some people saying it's a two-step question, some people saying it's a one-step question, some people saying it's a three-step question. Well, Dr. Vicaria will go over that with you here shortly. Let's read the vignette. A 30-year-old man comes to the clinic because of a 2-month history of gnawing pain in his upper abdomen just below the ribs. The pain generally improves with meals but is worsened by consumption of spicy food. He denies any fever, fatigue, bloody sputum, or blood in his stool. The patient has been taking a proton pump inhibitor, or PPI, as directed for the last month, but his symptoms have not improved. 3 months ago, he sustained a painful knee sprain and took up to 3,000 milligrams daily of ibuprofen for pain. His last dose was 2 months ago. On examination today, he is afebrile and his blood pressure is within normal limits. Pulse is 75. His abdomen is soft and non-tender, without rebound or guarding. Esophagogastroduodenoscopy, EGD, is performed and reveals 2 ulcers distal to the duodenal bulb. Gastrin levels are also drawn and come back as 1500. Which of the following is the most likely cause of this patient's condition? Dr. Vicaria.
Thank you, Sean. So I think in terms of how many steps do we think this question is, I think first we need to figure out what is going on. What is a condition that this patient has? 2, I think we need to figure out obviously what's causing it. And so at a minimum, this is probably a 2-step question. There's a chance, without looking at those answer choices right away, there's a chance that they could be taking it a step further and maybe getting into the pathophysiology of it. So it's possible this is a 3-step, but at a minimum, a 2-step question here. So let's go ahead and look at those answer choices. So answer choice E, neoplasm of the duodenum. D, mucosal ischemia. C, medication side effect. B, colonization by Helicobacter pylori or H. pylori. And A, autoantibodies to parietal cells. So once again, we'll give everyone a few seconds to gather your thoughts. Go ahead and select the answer choice that you think is correct, and we'll talk about it in just a few seconds.
Excellent. Thank you, Dr. Vicaria. So this will be our last question of the evening, and then we will have a raffle as well as a very special offer for you guys. So make sure you stick around. Today might be your lucky night. I'll give you guys a couple more seconds to respond. We've done some challenging questions today, but everything we've covered is very high yield. So hopefully you guys have all learned something from this and will join us next week when we cover cardiac physiology. I'll give you guys a couple more seconds. It looks like a lot of you guys have responded. And let's take a look and see how you guys did. Looks like 49% of you guys picked medication side effect, and 26% of you guys picked neoplasm of the duodenum. Okay, let's see what the correct answer is. And the correct answer is E, neoplasm of the duodenum. I saw a lot of you guys actually typing in the correct response in the question box, so well done. Once again, if you got it wrong, not a problem. Just pay attention to Dr. Vicaria and you'll get it right on testing. Dr. Vicaria.
Thank you, Sean. So great job to you guys. Yep, this is also a tough question. So let's review Zollinger-Ellison syndrome. So this is a gastrin-secreting tumor that causes acid hypersecretion. So because of that, you get recurrent ulcers. So you would have elevated gastrin levels, and then the patient, like this patient, you would present with abdominal pain because of those ulcers and maybe diarrhea as well. Importantly as well, it may be associated with MEN1 or multiple endocrine neoplasia 1. Quick review for you guys. Can you guys name the other components or just the different components that you may see in MEN1? What kind of tumors would you see? Go ahead and post that in the question box and we'll talk about it in just a second.
So a lot of people are saying parathyroid, 3P, pancreatic tumor, pituitary, and medullary carcinoma. Dr. Vicaria.
Absolutely, yep. MEN1 classically is the 3Ps, perfect. Parathyroid, pancreas, and pituitary gland. So great job there. Now let's get back to this question. So this is a 30-year-old man who had a 1-month history of daily NSAID use, and he was using a good amount of NSAIDs. He also reports this gnawing abdominal pain for 2 months. They did an EGD, and it showed that there were 2 ulcers that were pretty deep in the duodenum, pretty distal, specifically distal to the duodenal bulb. So as you guys probably picked up on, this patient does have ulcers or peptic ulcer disease. Notably, as mentioned, they're distal to the duodenal bulb, and they were also refractory to PPIs. They also then told us that his gastrin levels are elevated. So this should make you concerned for Zollinger-Ellison syndrome, which is a neoplasm potentially of the duodenum. So the increased gastrin, as we mentioned, can lead to acid hypersecretion, and then it can lead to ulcers, especially those in atypical locations like this. Your typical ulcers due to H. pylori infection or NSAID use, we talked about that, usually are proximal duodenum or antrum of the stomach. Distal duodenum is a little bit more atypical. So as we mentioned, Zollinger-Ellison syndrome can be confirmed by an elevated gastrin level greater than 1,000, and then also a paradoxical rise after giving a secretin. As mentioned, we also talked about how this could be a component of MEN1, so keep that in mind as well. Now let's talk about why the other answer choices are likely incorrect. So mucosal ischemia, you can see that with a few things, particularly curling ulcers, which we talked about, such as cutaneous burns leading to hypovolemia and then mucosal ischemia. There's nothing in this patient's story about hypovolemia or burns, so probably an incorrect answer choice here. Now let's talk about C, because I know a lot of you guys selected that. Medication side effect, so probably getting at the NSAID use. Now, NSAID use and overuse does remain one of the most common causes of ulcers. But given the atypical location of these ulcers and the fact that it didn't respond to proton pump inhibitors, not very consistent with NSAID-induced ulcers. In addition, he hasn't taken NSAIDs for a full month and still hasn't had any improvement. So some clues there that this may not be just the NSAIDs going on. And then lastly, or actually answer choice B, colonization by H. pylori. This is also a common etiology of both gastritis and peptic ulcer disease. However, again, the location of these ulcers is atypical for H. pylori induced ulcers, and the elevated gastrin levels also kind of point us to a different etiology. And then lastly, autoantibodies to parietal cells. This is getting at autoimmune gastritis, where you have autoantibodies causing destruction of those parietal cells. In this situation, ulcers would most likely be found in the stomach instead of the duodenum, especially the distal duodenum. So also likely an incorrect answer choice in that question.
Excellent. Thank you, Dr. Beccaria. So that brings us to the end of our 4 questions. Once again, next week, Tuesday at 6 p.m., we'll be doing cardiac physiology. Before we continue on to the raffle, I want to share with you guys and show you RX bricks. So if you guys haven't taken a look yet, make sure you take a look. If you have RX 360, you now also have access to RX bricks, which is great. So here's a brick on peptic ulcer disease, since we talked about that quite a bit today. As you can see, the brick starts off with our learning objectives. And so we have 6 learning objectives here for peptic ulcer disease. As we continue the content review here, we will learn all about peptic ulcer disease. We have some little quick questions there for you to answer to make sure you're digesting that information. And here's Zollinger-Ellison syndrome, or ZE syndrome, which we just talked about, right? And as we continue to go down, we will see more content review. And then at the towards the end, you will start seeing here a summary of what the take-home points from this brick are. Once you are comfortable with that, you'll have some practice questions you can answer to test your knowledge of the subject matter. And once you've done that, you'll scroll down and review these learning objectives and cross off these based on your level of confidence. If you want to continue learning more about peptic ulcers, you can then go to that page or pages in first aid, go to flash facts to review it, or get some more information on it by watching our Express videos. And then, of course, you can practice your knowledge and apply it by doing questions in COMLEX. And we even have estimates on how much time it would take you to do these in our various resources. So make sure you check out RX Bricks. We have some wonderful bricks available. If you don't have access to RX 360 Plus, please sign up for a free trial. Take a look at the different products we offer. There's a reason why so many students use us and find success with it. There are some free resources available to you right now, including a free brick on COVID. So make sure you check that out.